Hello, I'm Dr. Shel. Today I'd like to speak to you about something that all of us deal with, stress. And what does stress lead to? With our culture being such a high-stress culture, we're always trying to accomplish things and get to the next level of success, and also balancing everything. Most of us have work, families, perhaps spouses, kids, and everything needs to get balanced. In order to do that, it really puts a lot of load on our adrenal glands. So when you combine high stress, poor diet, lack of exercise, throw in perhaps smoking or alcohol use, and the lack of meditation and other stress management techniques, our adrenals take a super large load and eventually they burn out. When the adrenals start burning out, what happens is they are no longer capable of producing the right amounts of cortisol at the right time during the day. There is a way to test yourself to see if you do indeed have adrenal issues. My personal preference is to do a salivary cortisol test, which you can find out more information about on my website, but this way you can see what your circadian rhythm is. Your cortisol should be highest in the morning, little lower in the afternoon, lower in the evening, and the lowest at bedtime so you can sleep well. When I see patients in my office, some of the patients have cortisol all over the place. Some have it really low in the morning and very high at night, thus leading to one of the prime symptoms of adrenal fatigue, insomnia. The other symptoms of adrenal fatigue is exhaustion, fatigue, hair loss, weight gain, depression, anxiety, chronic infections, so many things that are related to stress and adrenal function. Because let's face it, if your adrenal glands don't work well, you're going to constantly be in a fight or flight response. And if that's the case, your other hormones will no longer be balanced, such as your thyroid, your sex hormones, even your melatonin. So there are so many things that go off balance because of your cortisol. We actually have an entire adrenal rebuilding program that I teach my patients about if their adrenals are not working correctly. We always start with testing, which I mentioned earlier, and then we really go into balancing the thyroid, the sex hormones, the nutrition, make sure they're getting the appropriate amount of nutrients, whether it be orally or through IV therapy. We get them on antioxidants. I also recommend meditation, yoga, and other stress management techniques, as well as exercise and healthy eating, lots of water. So if you're interested in finding out more about your adrenal glands or what your stress may be doing to your body, if you have any of those symptoms, please just give us a call or go to my website, drshel.com, and we'll be happy to help you in any way that we can.